So I did something a little bit crazy. I asked ChatGPT to play Audiologist for a day. Now, I use AI all the time. I get the appeal. You're sitting at home, your ears are ringing, or maybe things sound muffled, and you want answers right now. So you pull out your phone, you type in the question, and boom, ChatGPT gives you what sounds like a solid answer. But here's the thing, I've been there too. A while back, I actually asked ChatGPT a medical question about myself just to test it. The response came back instantly, in that confident, reassuring tone it's known for. But as I read through it, I could feel something was off. It skipped over critical red flags. It gave general advice without asking any follow-up questions I'd need to actually have a diagnosis. At that moment, it stuck with me. Because if I hadn't known what I was looking for, that answer would have sounded pretty darn convincing. That's when I realized this isn't just a convenience issue, it's a safety issue. So I ran a full experiment. I asked ChatGPT the same exact questions my patients ask me every day about hearing loss, ringing in the ears, dizziness, and more, and the results honestly kind of freaked me out a bit. To be fair, I didn't try to trip it up. I asked simple, real questions, things people actually search for every day. My hearing seems muffled in one ear. What should I do? There's a constant ringing in my ears. How do I make it stop? What are the best hearing aids for me? I'm feeling dizzy and my hearing keeps changing. What could that be? These are the kinds of questions I hear in my clinic all the time, but the answers I got from ChatGPT, that's what made me hit record on this video. Quick pause. If you could do me a favor, please hit the like button and subscribe to the channel. We put out honest, real-world content like this every week to help you protect your hearing and make smarter health decisions. Thanks. All right, let's start with the first question, muffled hearing in one ear. ChatGPT gave a decent list, earwax, fluid, ear infection, then it said, see a doctor if it doesn't go away. That sounds reasonable, right? But it completely missed one of the biggest red flags we see in our clinic, sudden sensorineural hearing loss. This is a hearing emergency. You've got just a few days to treat it, sometimes less. Delay can mean permanent hearing loss. No do-overs. A real audiologist knows this. We're trained to spot those warning signs immediately. ChatGPT skipped the most urgent part. The next question was about the ringing in the ears, tinnitus. And the AI did okay here. It mentioned sound therapy, stress, maybe hearing aids, but again, it missed critical context. It did not ask if the ringing was in one ear or both. It also didn't ask if the tinnitus pulsed like a heartbeat. That kind of ringing can point to vascular issues, stuff that needs medical attention ASAP. Instead, the AI suggested a white noise machine. Then the question about the best hearing aids. ChatGPT gave a list of features and brands, which is about as helpful as saying, here's a list of cars, pick one. Hearing aids aren't earbuds, they're medical devices. They need to be tuned precisely to your hearing, and without a hearing test, the advice is useless. And finally, dizziness with changing hearing. That's a red alert for something called Meniere's disease. But ChatGPT didn't even mention it, not once. That kind of miss could lead to someone just brushing something off that is actually quite serious and suffer consequences for it. So what's the difference between AI and a real audiologist? Well, it starts with the conversation. We learn about your life, your work, your hobbies, your struggles. That context matters. ChatGPT can't see the full picture. It doesn't know you. Then we actually will look in your ears. We might find earwax or an ear infection or a broken eardrums. We can catch those things early. We also will do tests in soundproof rooms, not just hearing beeps when pressing the button, but speech and noise tests, middle ear function tests. We want to look at your cochlear health, and based on that data, we create a plan. If you need hearing aids, we don't just sell you one. We find the right fit for your ears, your life, and your budget. And yes, AI is part of that process. The hearing aids themselves are smart and use artificial intelligence, but that smartness is only as good as the expert who programs them for you. So would I trust ChatGPT to be my audiologist? Not even close. No way. It's fine for learning what an audiogram is, but when it comes to your symptoms and your health, it's just not worth the risk. ChatGPT and other AIs just don't see red flags. It doesn't know your story, and it definitely doesn't carry the responsibility of protecting your hearing. If this video resonated with you, and if you've ever asked ChatGPT for medical advice and thought, is that really right? I'd love to hear from you. Drop a comment below and share your experience. What did it get right and what did it miss? And if your ears are bothering you, or even if you just want to learn more, head over to our website. I've linked it in the show notes below. We've got real tools, real answers, and real people ready to help. Because when it comes to your hearing, you deserve more than just an instant answer. You deserve someone who's actually listening.